The 2024 Global ESG and Sustainability Lecture Series. Today's lecture will be delivered by Professor Tony Capon, Director of Monash Sustainability Development Institute, Monash University. Following the lecture, we'll have a panel discussion and a Q&A session. I'm Samhita Ankareddy, the moderator for today's session, and I'm also a PhD student at Korea University. The 2024 Global ESG and Sustainability Lecture Series commenced this April, and the past 6 sessions drew audience from various geographies and diverse expertise. We encourage you to look forward to today's session as well as the upcoming sessions, participate actively and engage with us further. You can find more information on our website regarding speakers and registration. Moving to today's session, Professor Capon will lead the discussion, provide in-depth exploration of the interconnectedness between human health, environmental sustainability, and social justice. Attendees can anticipate an engaging discussion on the imperative of adopting holistic approaches to address planetary health challenges and create more equitable and sustainable societies. Before we dive into the session, I would like to give you all a brief about our speaker. Professor Capon directs the Monash Sustainability Development Institute and holds a chair in planetary health in the School of Public Health and Preventive Medicine at Monash University. A public health physician and authority in environmental health and health promotion, his research focuses on urbanization, sustainable development, and human health. Professor Capon is a former director of the International Institute for Global Health at United Nations University and has held previously positions like professional appointments at the University of Sydney and Australian National University. He is a member of the Rockefeller Foundation Lancet Commission on Planetary Health that published its report Safeguarding Human Health in the Anthropocene Epoch in 2015 and the International Advisory Board for the Lancet Planetary Health. At the end of the seminar, we'll have a panel discussion and a Q&A session, and I request all of you to actively interact with Professor Capon and our panelists. With this, I would like to extend a warm welcome to our speaker, Professor Capon, our panelists, and our participants. Without further ado, Professor Capon, the floor is all yours. Thank you.
Well, thanks very much, Samhita, and wonderful to be with you all today. I'm on Wurundjeri country here in Melbourne, Australia. The Indigenous people call Melbourne Naarm. And as I begin, I'd like to acknowledge the care for country over millennia by Indigenous people here in this part of Australia. I'll share my slides. As Samhita said, my topic today is planetary health, creating healthy, just, and eco-sensitive civilizations. In this talk, just a minute, I'm just going to have to try and sort this out here because I've ended up with the view. Oh. I'm going to have to stop sharing. Sorry, I'm just having trouble here. Right. Thank you. Apologies for that. In this talk, I'd like to do 5 things. First, make sure that we're all on the same page with the idea of the Anthropocene. Secondly, reflect on some relevant history. And then move to the Rockefeller Foundation Lancet Commission on Planetary Health and explore key findings there. And then broaden out, thinking ecologically about civilizations and health. And finally, so what? So the Anthropocene epoch, many of you are likely to be familiar with this term, which is being used by some earth scientists to describe a new epoch as we move from what's called the Holocene epoch. In many ways, the ideal epoch for human life on Earth. Consider the Goldilocks epoch, if you like, not too hot, not too cold. And now that we're changing Earth systems to such an extent that in years to come, these changes will be seen in the fossil record on Earth.
Tony, can you hear us? Yep.
Yes.
Your slides are not showing. And then Samhita, I think she is trying to speak, but for some reason, her mic is not audible, but she's unmuted.
Okay. Maybe I better stop sharing. We better try again. Do you think I might have to leave the Samita, can you see me? Shall I try sharing again? I'm not sure what's happening here.
We could see your slide, Tony, when you first put it up, but then it went away. So now
I
your
think we can see.
sharing is starting. So we see, slide view with multiples. So maybe go to presentation mode.
And can you see it again now? Or?
We see your cover slide now.
Right. And you can see this next slide?
Yeah, looks good.
And you all
Okay.
can hear my voice, right?
And
Yes.
yeah, and Samita's back also. I think we're all set.
Okay. Well, let me start again. Apologies for that. I'll go as quickly as I can through these slides. So, as some of you may have heard, I'd like to do 5 things. First, make sure we're all on the same page with the idea of the Anthropocene. Secondly, reflect on relevant history. Thirdly, refer to the findings of the Rockefeller Foundation Lancet Commission on Planetary Health. And then broaden out, thinking ecologically about civilizations and health. And finally, so what? So let's watch a short animation about the Anthropocene to make sure that we're all on the same page with this concept.
This is the story of how one species changed a planet. The latest chapter of our story begins in England 250 years ago. Fueled by coal, then oil, several brilliant inventions appeared. They ignited the Industrial Revolution, which spread like wildfire through Europe, North America, Japan, then elsewhere. The great railways, then cars and highways, connected people across the globe. Medical discoveries saved millions of lives. New artificial fertilizers meant we could feed more people. Population rose rapidly. But this was nothing compared with what was to come. The 1950s marked the beginning of the Great Acceleration. Globalization, marketing, tourism, and huge investments helped fuel enormous growth. People swarmed to cities, which became even more powerful engines of creativity. In a single lifetime, the well-being of millions has improved beyond measure. Health, wealth, security, longevity. Never have so many had so much. Yet 1 billion are malnourished. In a single lifetime, we have grown into a phenomenal global force. We move more sediment and rock annually than all natural processes, such as erosion and rivers. We manage 3/4 of all land outside the ice sheets. Greenhouse gas levels this high have not been seen for over 1 million years. Temperatures are increasing. We have made a hole in the ozone layer. We are losing biodiversity. Many of the world's deltas are sinking due to damming, mining, and other causes. Sea level is rising. Ocean acidification is a real threat. We are altering Earth's natural cycles. We have entered the Anthropocene, a new geological epoch dominated by humanity. This relentless pressure on our planet risks unprecedented destabilization. But our creativity, energy, and industry offer hope. We have shaped our past. We are shaping our present. We can shape our future. You and I are part of this story. We are the first generation to realize this new responsibility. As the population grows to 9 billion, we must find a safe operating space for humanity, for the sake of future generations. Welcome to the Anthropocene.
So as the credits for that animation go up, you'll see that it was developed by the International Biosphere Program, which is an interdisciplinary science program hosted by the Swedish Academy of Science. And the animation was used to open the Rio +20 conference back in 2012. And I still find it a very useful animation because in 3 minutes, it helps us share that understanding of the scope of challenges that we face together. And it also finishes with that positive message that there is hope, we can change. It's in that context that Richard Horton, the editor-in-chief of the Lancet Medical Journal, worked with the Rockefeller Foundation to convene a commission on planetary health back in 2014. This is a copy of the title of that report, Safeguarding Human Health in the Anthropocene Epoch. A list of commissioners here. You can see I was greatly honored to be one of those commissioners because, as Samita said at the time, I was directing the Global Health Institute at United Nations University. But the other commissioners came from a range of different disciplinary backgrounds. There were environmental scientists, political scientists, economists, for example, and from different parts of the world. Importantly, the bottom line on this slide, the work we did in that commission built on other work, including the One Health approach and, importantly, the Brundtland Commission. Here is a picture of Dr. Gro Brundtland and the report of the commission she led back in the mid-1980s, the World Commission on Environment and Development. Dr. Brundtland originally trained as a medical doctor in Norway before she went on to be Prime Minister of that country, later to chair this important commission. And towards the end of her career, she led the World Health Organization in Geneva. One thing that is important to remember about this concept of sustainable development, which was really popularized by that work that she led, it is founded in concern for the well-being of people across generations, our legacy, if you like, between generations, thinking about generations to come. Of course, we can look back, and Hippocrates, for example, considered the father of Western medicine as it's currently practiced, more than 2,000 years ago in ancient Greece, was writing books like this on airs, waters, and places. So some of what we need to do in planetary health is actually reclaim these understandings because as we've modernized, we're leaving some important thinking behind. And of course, we can go further back. Across the world, no matter where we're from, there are longer lens stories in many parts of the world, indigenous people still practicing their cultural practices in a contemporary context. And Waiora is a Maori word from New Zealand for well-being and healthy waters. And it was the framing for the International Health Promotion Conference back in 2019 in Rotorua, promoting planetary health and sustainable development for all. My family is Ngāi Tahu Maori and Scottish from the very south of New Zealand. So wherever we live, and including across Asia, traditional understandings of human place in nature and health and well-being are relevant. What did we find in the Lancet Commission? Well, importantly, by almost any measure, the human population is healthier now than ever before. And here, life expectancy data from the World Bank, the black line in the middle of this chart, showing life expectancy from 1960, when it was in the low 50s, through to 2010 in this chart, when world average life expectancy reached the high 60s. It's now in the low 70s. 70s. And you can see that in all of the World Bank regions here, life expectancy has been increasing through this period, but notably significant inequities in life expectancy for people in Africa, South Central, and West Asia. In achieving those health improvements, we've exploited the planet at an unprecedented rate. And here, the ideas presented in that animation, escalating carbon dioxide emissions, ocean acidification, energy use, global deforestation, water use, fertilizer use. The list could go on, and we saw this in that animation. And this is the idea of the great acceleration that, as you can see, many of the takeoff points are in the middle of the 20th century, around the 1950s. So what's planetary health? The definition we used for the Lancet Commission was that planetary health is the health of human civilization and the state of the natural systems on which it depends. We know quite a bit already about the links between environmental change and health. More than 20 years ago, the Millennium Ecosystem Assessment developed this conceptual framework for thinking about these relationships. On the left here, escalating human pressures on the global environment. In the middle, a list of environmental changes and ecosystem impairments, from climate change through forest clearance and land cover change, biodiversity loss, urbanization, down to damage to coral reefs and ecosystems. And on the right here, three broad categories of health effects. The direct ones, the direct health impacts of floods, fires, heat waves, straightforward and readily understood as challenges that we confront together. In the middle, ecosystem-mediated health effects. This is where we need to start thinking in a more systems way. Altered infectious disease risk, for example. Reduced food yields in the context of prolonged drought, undernutrition and stunting as a consequence, depletion of natural medicines, mental health challenges. And at the bottom here, a category of indirect, deferred and displaced health effects. The diverse health consequences of livelihood loss, for example, population displacement, including slum dwellers, perhaps in large delta cities in Asia. So a wide range of potential health consequences from these environmental changes that intersect with social changes and social determinants of health as well. Importantly, climate change and health is an equity issue, and I find these scaled maps of the world from Jonathan Patz's team quite useful. Here in panel A, a scaled map of the world showing which countries are responsible for the carbon emissions that are already in the Earth system. And so you can see that United States is scaled up here, United Kingdom, Europe, and Japan, countries where there were major industrial revolutions. In the second panel here, you can see those who are already being affected by climate change. And in particular, you can see Sub-Saharan Africa and South Asia scaled up. So those least responsible for climate change are already the most affected. It's a significant equity issue. A few slides about key findings from the Commission. Estimates of air pollution deaths around the world from the World Health Organization. Every year, more than 3 million deaths from ambient air pollution, more than 4 million from the household burning of solid fuels. Often women responsible for cooking, for example, unflued cooking inside homes. more than 7 million shortened lives around the world every year from air pollution. The effects of multiple environmental changes on food availability and quality. So climate change, absolutely, with a range of effects you can see there on food availability and quality, but also land degradation and soil pollution, soil erosion, water scarcity, loss of pollinators, overfishing and ocean acidification. And then emerging diseases across our region. We have seen on this side of the Pacific, H5N1 back in 2003, SARS as well. In the African region, HIV and Ebola. In the Americas, Zika. Changing land use, forest clearance, loss of habitat for wild animals, often meaning that they need to come closer to where people are living, perhaps on the edge of cities, to find food, and new opportunities for spillover of novel pathogens from wild animals, perhaps through domestic animals, to people. And we're seeing accelerating rates of these spillovers. That's the story of the challenges that we face, but importantly in the Commission report, about half of the report was about what we can do about it. Developing sustainable and healthy cities. This is an area where I've worked for some time. Active travel, public transport, reducing that air pollution, green spaces, biodiversity, reducing the urban heat island, and bringing mental health benefits. Watershed conservation, access to healthy food grown in cities potentially, and increasing resilience to floods, storms, and droughts. Multiple approaches for meeting increased food demand. Here, total global cereal production in millions of tons from 1960 projected through to the middle of this century. And you can see escalating demand for food requirements projected to further increase into the future. Some of that for direct human consumption, but importantly, quite a bit of it for the consumption by animals that people will eat. And you can see here on the left a list of innovations that are helping to meet this increasing food demand with potentially avoiding land clearance into the future. Notably at the bottom of this list, reducing food waste, which is of course a critical issue. We found in the Commission that nearly 30% of the world's total agricultural land is currently being used to produce food that's never eaten. In low-income countries, perhaps the food will spoil because of lack of refrigeration or vermin, for example. In high-income countries, food is thrown out from the table, perhaps sometimes directly from the fridge. And so if we avoided that food waste, we could feed many people, we could share that food much more fairly across the world as populations continue to rise. So lots of work there to do on reducing food waste. Relatedly, thinking about healthy diets, plant-rich diets, lower footprint on the earth, and better for our personal health, lower rates of chronic diseases, for example, when we eat a plant-rich diet. And forest conservation, reducing disease risk. Examples here from the Brazilian Amazon in terms of malaria transmission. When we conserve forests, fewer vector breeding sites, larger vector predator populations, for example. In terms of acute respiratory infections, forests can help filter air particulates, fewer fires, lower smoke emissions, reduce collection and burning of biomass fuel, and diarrheal disease because the forests can reduce flooding and filter pathogens in the surface water. And of course, at the heart of the challenge that we confront in planetary health is our wasteful current economic model, the dominant economic model around the world. And we need to transition rapidly to a more circular way of understanding our economy and thinking about waste in new ways, thinking about waste as resource, reducing, reusing, recycling, perhaps not using the term waste anymore because we understand that these are all resources and the byproducts of one process can be an input into other processes. So in conclusion, we found that solutions lie within reach and require a redefinition of prosperity to focus on quality of life and improved health for all, together with respect for the integrity of natural systems. We identified 3 broad categories of challenges: conceptual challenges, failures of imagination, if you like. A good example here is the way we measure progress. Often governments rely on measures like gross domestic product, which is tracked from year to year, and it's really, in essence, it's a measure of economic activity. We need to complement measures like that with measures of human development, human health, and the state of the environment. Beyond GDP is a term that you may have heard in this context. Governance challenges, failures of implementation, if you like. And one example is the work being done in Wales on the well-being of future generations. It's effectively a Sustainable Development Act of Parliament that requires all government agencies to think about the implications of their decisions for future generations, not just for the current voters. The third category, research and information challenges, very relevant to APRU universities, failures of knowledge, if you like, and here the need for transdisciplinary approaches, valuing know-how alongside academic disciplines, whether that's policy know-how, the know-how from people in society and practice, farming know-how, for example, and the know-how of Indigenous people. Here's a link to that commission report, as well as the 50-page report. There's other shorter pieces of writing, there's video material and infographics that you may find useful. At the same time as we were doing that commission, we were working together around the world to shape the Sustainable Development Goals, and we're now about halfway through that process. From a human health and well-being point of view, the World Health Organization encourages us to think about the SDGs in this way, with health and well-being, if you like, as an outcome of development, and the other 16 SDGs around this platter, making clear that they're all foundations of health, whether it's economic, social, or environmental foundations of health. Since the Commission report was published, we've had funders, Wellcome Trust, for example, investing more in this kind of research. And we've got new journals, Nature Sustainability, Lancet Planetary Health, among others, journals publishing this kind of transdisciplinary work that has traditionally been hard to publish. To come to this broader question of civilization and how we think about a civilization that would be healthy, just, and eco-sensitive, we need a conceptual framework for that. And I find the work of Stephen Boyden, the human ecologist, very useful. One of his books, The Biology of Civilization, Understanding Human Culture as a Force in Nature, Stephen presents a conceptual framework for what he calls the total system. We can think about this as the way a civilization works. So if we explore this, on the left here, we've got the cultural system. In that first box, cultural options, our worldview, what we know about, what we believe, and what we prioritize. This will influence the variables in the second box, the societal arrangements we put in place, the economic system we have, the government regulations, what we're learning about in our educational institutions. These cultural options will influence a range of biophysical options here in the middle. In box 3, the human population, the numbers of people, the densities, the groupings, where they're living. In box 4, the human activities, the behaviors, the things we're doing collectively, the fuels we're using, how we're making energy, for example, how we're manufacturing, how we're farming, and the human activities that are individual, our lifestyles, the way we make a living, the way we move. And then box 6 here, the artifacts, an ecological term for the things we make. The buildings we make, the roads we make, the vehicles, the machines, for example, the vegetable gardens. Those biophysical options, of course, can only happen because of the broader biophysical environment with its physical elements, the atmosphere, ocean, clay, and rocks, and all the living elements, plants, animals, and microorganisms, for example. So these are, if you like, the variables in the total system, the variables in our civilization that we can change. And the bottom line in this slide, the health of humans, other animals, and natural systems are emergent properties of the way this total system operates. And when we intervene in the system, we have to think about potential consequences, sometimes unintended. But as researchers, as policymakers, as actors in the system is constantly changing, but the health is an emergent property from the way the system works. If we boil that down and think about it from the perspective of a particular discipline, like public health where I work, all of these human activities that we're doing have potential positive or negative impacts on our health. We talk about behavioral risk factors. We talk about social determinants of health. Importantly, in public health, we don't do enough thinking about the environmental impacts of those human activities. We leave this to others, but as we've seen in the kind of things that I've been talking about, things that perhaps you're passionate about already too, that there is this new category of determinants of health, ecological determinants, a term coined by our Canadian colleagues about 10 years ago now, that as we change the earth, those human activities impacting on the planet, the environmental determinants of health, have consequences for human health. And then the arrows in the opposite direction, reminding us to remember there will be feedbacks, there's potential unintended negative consequences when we make changes. So Stephen Boyden, the human ecologist, calls this a biosensitivity triangle as quite a useful way to ensure that we are thinking more systemically about the work we do. In my work, I focus on urban policy, planning, design, development, and management, how that shapes human activities, and what that means for our health and the health of natural systems. Boyden recently published another book. He's now 99 years old, and he writes every day in his nursing home. From time to time, I visit him in Canberra. He actually originally trained as a veterinarian, as Valtrina has originally trained. And this is his most recent book that he published last year at the age of 98, A Biorenaissance, The Human Place in Nature, Past, Present, and Future. And in fact, Richard Horton wrote about this new book last month in The Lancet. And you'll see that here, Richard refers specifically to Stephen's work and the idea of a biorenaissance, the need for us to change the way we think about our relationship with nature in everything we do in society. Horton makes the point in this piece of writing last month that we actually know quite a bit about what we need to do. It's about how we go about doing it. How do we change cultures, change systems, and ultimately change behavior across our civilizations? So my final slide. So what does all this mean? Importantly, we need what we might call an eco-social approach, an approach to the way we think about the world that recognizes ecological, economic, and social foundations of human health and well-being. Secondly, critically, we need to think in systems, acknowledging the interdependence of all species on Earth, including those we can't see. It's critically important that we think about the trillions of good guy microorganisms that we need every day on our mucosa, in our gut, so that we are healthy. In medicine and health, we often focus very much on pathogens, as we did, importantly, from a public health point of view, during the very confronting COVID-19 pandemic in recent years. But we can't lose sight of the fact that we actually need lots of healthy, good guy microorganisms to live every day. Thirdly, intergenerational health equity. In health work, we often focus principally on people who are currently alive in the world, perhaps those about to be born, when we think about maternal and child health. But we neglect thinking about future generations. And this is where Indigenous knowledge can be relevant, because Indigenous peoples often think multiple generations ahead. And in point 4 here, we need to value that know-how and take this more transdisciplinary approach in the work we do, whether it's research or education in a university. So final point here, perhaps a summative point, that we in the APRU network need to bring a planetary consciousness to all of our research, education, and our engagements with policy and practice. So thanks very much, Samita. I'll stop sharing, and apologies for those technological problems at the beginning of that.
That's very all right, Professor. Don't worry. Thank you very much, Professor Capon, for your talk and insights about planetary health and its interconnectedness between human health, environmental sustainability, and social justice. Now, we'll shortly move to the panel discussion session. Allow me to introduce our esteemed panel members for today's session. We have Dr. Renzo Quinto, who is an Associate Professor of Global and Planetary Health at the Singh Health Duke NUS Global Health Institute, Duke NUS Medical School, National University of Singapore. Professor Quinto's work focuses on the climate health nexus, including climate resilient health systems, mental health impacts of climate change, and climate migration and health. He also serves on the editorial board of the Lancet Planetary Health and contributes to several Lancet commissions, including the Commission on Sustainable Healthcare. We also have Dr. Wutrina Smith, who is the Associate Dean for Global Programs at the UC Davis School of Veterinary Medicine. She leads a multi-campus center for planetary health in the UC Global Health Institute that works across the 10 University of California campuses and with international partners to promote collaboration for research and training opportunities. She currently leads the USAID One Health Workforce, a next-generation project that unites over 100 universities across 17 countries in Southeast Asia and Africa in utilizing a One Health approach to
now, and the recording of the program
Good
gets
idea.
recorded. Samhita?
Yeah. I'm sorry. Okay, now we'll get started with the panel discussion session. The panel discussion will go for about 20 minutes. We also request our attendees to post their questions freely to the Q&A box or raise their hands using the raise hand function on Zoom to ask a question to the panel or discuss something with them. Over to you guys.
Okay, as we were just discussing, Samhita, before or after you disappeared, maybe I and Watrina will, give some reflections on what we heard from Tony. And of course, Tony, thank you very much for that very comprehensive talk, which I heard a few times already. But it is good because I think we need more and more, people, colleagues, health professionals, the next generation to be hearing, these messages. And I've been doing my rounds also in terms of, spreading the quote unquote gospel of planetary health, especially here in Southeast Asia. And I think, and what I'm observing is that there's a lot of energy and excitement and interest in planetary health, especially for young people. Whenever I talk to, especially young health professionals, future physicians, doctors in training, also nurses and other health professionals, I always try to simplify planetary health in this manner. In the 21st century, we now have two patients, not just the people, but also the planet. And it speaks to the interconnected challenges that you described to us at the start. It's not only people who are getting sick, the planet is also ailing, which, by the way, got sick also because of our own doing, and that's why it's very critical or essential that we understand, the Anthropocene. Some people ask, what's the difference between planetary health and maybe more traditional environmental health? A field that has been existing for decades. We've been studying how air pollution affects human health, or how our exposure to various range of chemicals lead to, let's say, congenital anomalies or some other health effects. But I think planetary health really emphasizes, among many other things that you highlighted in this talk, that, we created these problems, the anthropogenic nature of this challenges or issues at the nexus of human health and the environment, that cannot anymore be ignored. And so we cannot just do traditional, for example, environmental health approach or even medicine, looking for the cures to the human health problems while ignoring the underpinning upstream factors or drivers that create these problems in the first place. So that's, I think, one thing that I want to highlight from your presentation, especially for our audience. And that is the message that we're trying to really promote, not only in Singapore, not only in my home country, the Philippines, but across Southeast Asia. You mentioned towards the end what we need is planetary consciousness. And I think that's what planetary consciousness means. Recognizing that we are contributing to the climate crisis, to the biodiversity crisis, and many other planetary health challenges. So, for example, how are we contributing? We, the health sector, we know, are also emitting our own carbon emissions. Some estimates say around 5% of the global greenhouse gas emissions are attributable to the health sector. I remember there's one study in Australia estimating it at 10% in your country, Tony. So, in short, we are accomplices to the crime of climate pollution, and we need to fix our own backyard, and we need to walk the talk. We cannot be talking about planetary health, but also still contributing to these many problems, and not only in terms of the way we use electricity, the way we produce and consume food, they are using plastic in the health sector. So those many other areas need to be addressed. And of course, we need to also work outside of the health sector. I remember Tony McMichael, who is one of the first to write about climate change as a health issue. He said in the 1990s that we, the health sector, must develop a capacity or a capability to work with other sectors and disciplines, especially the unfamiliar disciplines. That's a direct quote from his commentary, like climatology, meteorology. So planetary health also opens an opportunity for us to work with other disciplines. And I think most of my collaborators in the many projects that I do and work on are non-doctors. Because we realized, and I realized early on, that if we want to tackle these challenges, we need to get out of our silo, our comfort zone, and work with, again, the quote-unquote unfamiliar disciplines. And I always remind my medical students that by the time they graduate from medical school, they should have at least 5 new friends who are not fellow medical students or fellow doctors. That's how you expand your sphere of influence, but also that's your way or approach to enrich yourself with the knowledge, the wisdom coming from other disciplines, and even from other knowledge traditions. You also highlighted the importance of really meaningfully and respectfully engaging, for example, with indigenous communities, but also with Asian cultures. The idea of the health being inextricably intertwined with the health of the planet. That is something that is already embedded in many cultures here in Southeast Asia that we need to revisit, that we need to revive, that we need to really put center stage in our approach to addressing many of these existential problems. So to conclude my opening statement so that we can have a vigorous discussion, we in the Duke NUS Medical School are trying to promote planetary health. We hope that by next year, we will launch something like a Center for Planetary Health with a more Asia focus. And we're happy to learn from your experience in Australia, but also from Katrina in the University of California, because this is really a great opportunity to advance education, scholarship, and engagement on many of these existential challenges that confront, as you mentioned towards the end, Tony, our civilization. I'll stop there. Thank you.
Thanks, Renzo. I can maybe just add a couple of comments, and then if there's questions from the audience, of course, we would love to prioritize that. So my name is Vatrina Smith. As was mentioned, I'm based in California, but I travel all over the world as part of really trying to foster the One Health idea, working across disciplines, working across sectors to address complex challenges. And planetary health is probably the most important challenge that we all have to work with, right? I'm a veterinarian. I was trained in outbreaks and infectious diseases, and everyone said, oh, the pandemics are the thing. And as we've started to really work through outbreaks and pandemics, it's coming up just as much. Climate and health is probably the existential threat to our world if we can't deal with it very soon. So we are on the brink or a tipping point of taking action and finding solutions, or having probably irreversible consequences that are quite significant for us and the future generations. So my personal approach to this is being optimistic and solutions focused. And what I've loved about working with partners across Southeast Asia, so the Southeast Asia One Health University Network is working across 8 different countries, including the Philippines, and really getting that One Health idea out there, originally for global health security, but now climate and health is also a part of that, on what we can train, what we can foster opportunities for, which I think is exciting. Universities, as you know, are here to stay for the long run. And so we love working with faculty and students and stakeholders around place-based education. Take the ideas that make sense for you and really think globally but act locally. So that's been so important. At the University of California, I lead a center on planetary health because we do really think this is going to be so important to keep activating and catalyzing conversations. And so that gives us a chance to try and innovate in the research and training opportunities that we can do across disciplines, across sectors, and thinking about California as one of the places that could be a launching point for new ideas that could certainly be adapted. One example I would give before I pass back to Tony for one of the questions that I think is in the chat box is thinking through picking one place that you care about, that you know well, and really focusing on what you can do to make that place better. Because if we're all just moving around all the time, we don't necessarily settle in to make the big difference that we can in the places that mean the most to us. So I've actually, since the pandemic, had a chance to settle in California for one of our field sites that I care a lot about. And now we're doing a lot more, trying solutions that will improve water quality, ecosystem, doing training opportunities that really demonstrate what's working so that those ideas can then be applied in other places. In this case, for headwaters restoration and those types of things, getting the native tribes that have been there way before I was to really come back and say, hey, these are the things that we think are important. And those dialogues and those partnerships take a long time to really build and foster in an equitable and respectful way. So I'll pause there and just say, I think we have a lot of work to do, but if we all really think about what can we as an individual do to make a difference, how can we reach out to other disciplines and colleagues around the world and find a way to make a difference locally, I think it will add up, and I think we can do it. So back to Tony for comments he might like to address.
Oh, great. Thanks very much, Vatrina and Renzo. Great comments there. And I would like to pick up on, there's a couple of questions there. Others might also have thoughts about these questions. So Sam's question, thanks very much for that, Sam. These questions of governance are critical, and we can think about governance from the point of view of nations, but also elsewhere in society, industry, for example. And so in terms of nations, then the UN architecture is the only cross-national system we have. And of course, we have the UN framework conventions on climate change and biodiversity, and they are one mechanism. Importantly, we have the new governance mechanisms related to the and sector, the task force on climate-related disclosures, the new task force on nature related disclosures as well. And so these are going to be governance requirements. The boards of companies are going to be expected to report on progress. And so it's taking time to get these mechanisms in place, but there's no doubt that this is going to change the way business is done in time. Of course, we'll find that some people will try and subvert the system, but these are the mechanisms that are being put in place around the world. A comment too from Arrow, thank you very much, Arrow, around are there some countries or sectors that are better equipped to organize and run a biorenaissance? I mean, in one sense, the biorenaissance itself can't just come from one country or one sector. This is something that we have to unite to achieve. We have had some focus in this discussion around human health and animal health perspectives. But as you point out in your question, engineers, politicians, we all have to get on board. And this is really about challenging the dominant culture changing the culture, changing the systems, and ultimately changing behavior. In a lot of our work in universities, in APRU universities, is focused on what is the problem, but we need to transition to focus on how we change the world for the better. In universities, this is called impact, not just impact factors of what we write, but the impact we're having in the wider world. Thank you.
I guess we have no more questions, and since we are also running out of time, I think we can close the session. So if you guys have any closing remarks, maybe you can put them out now.
I can jump in. And this is also regarding the question on governance. I think because governance is very difficult to address, and I think actually that's at the very root of the many planetary health problems that we are trying to tackle. What we need is advocacy and activism. We cannot do planetary health in a merely academic manner. I actually think that if you're embracing planetary health, you have activism, some activism also in your heart, right? And in your soul. Because planetary health, I think, is a testament of our dissatisfaction with the status quo. And yes, there's a role for the science that we create, the education that we deliver, but ultimately it's how we bridge, for example, academia. All of us are in academic institutions. How do we bridge academia with the real world, and especially with the very highly political world that unfortunately or fortunately governs many of these challenges, problems that we've talked about over during this webinar. So get out and be engaged in the real world and try to navigate the difficult politics, because that is where we really can truly make lasting changes. Thank you.
Thanks, Renzo. I can just briefly add, I think that, if those of you who are in the audience or are seeing this have follow-up questions, please reach out to us. We'd be happy to continue the dialogue and really explore how we can move towards solution-oriented efforts that will really pave the way for the future. So thank you for being with us. And as we think globally but act locally, I think we can all make a difference.
Yeah. We have now reached the end of the session. And before concluding the webinar, I would like to thank Professor Capon, our speaker for today's session, as well as our panelists, Professor Renzo and Professor Smith. I thank all our attendees for their participation. We extend our special thanks to APRU team for their support and Professor Yongsik Ok of Korea University for organizing these events and creating a learning and networking platform for students, researchers, and everybody who is interested. We request you to look forward to our next session as well. The next session is on November 19th by Brian Fox and Steve Meitel of University of Oregon on energy transition planning for higher education institutions. Thank you, everyone. We hope you all have a great day ahead. Thank you.
Thank you,
Bye-bye.
Sunita. Bye-bye.
Bye-bye.